Okay, you are live.
Okay, I'd like to thank everybody who's attending today. And if there are people watching from their homes on our live stream, I hope you find this informative and interesting discussion that has been going on with in 4 other groups throughout City Council that are taking a look at different aspects of policing here in Akron. This group met once and had discussion about community policing, and we heard a little bit about the history and about the different aspects of community policing. We've also had some discussion from other social service people telling us some of the things that they do that intersect with police work. And today we're going to take the opportunity to explore that even a little bit further. We had some plans to have an in-depth discussion about the dispatch office and program. Whoops. Okay. Oh, here's the agenda. Okay. So we're going to have to change that though. And I'm going to, before we get started, I'll ask for approval of the minutes. But we're going to just move the dispatch training and operation discussion to the next time because Lieutenant Simcox could not be here. But hopefully we'll have either he or someone else at our next meeting. And I know that we have Trayvon Richardson here, who's been doing research. He's a student at the University of Akron. Trayvon, if we have time at the end, you had an interesting article you wanted to sort of talk about that dealt with dispatch issues. So if we have time at that, I just got your message this afternoon. So if we have time, we'll get to it. If not, we'll make it part of the next meeting. Is that okay? Okay. So, and I just want to again thank everybody for coming here, and mostly also thank Mrs. Amobian for recruiting all of you and engaging you. And I'm going to turn it over to her to introduce you and sort of facilitate your participation.
Thank you, Mr. Swirsky. I just want to make sure, can you hear me okay, Sarah?
Yes, I can hear you just fine.
Oh, good. I want to thank all of the invitees, and Candace Palante is probably going to hold me to her debt for a long time. She's actually on vacation. So I've invited Jackie Pollard, and she is the manager of alcohol and drug services at Summit County Public Health. And she brought along one of her colleagues, Cody Jones. Tony, I hope I'm not mispronouncing your last name. And she's a peer recovery coach, and she's also with the Summit County Public Health. What I like for us to do, and I want you to feel free to just talk, and don't feel that you are pressured to perform or anything. I just want you to talk about your experience in working with the quick response team. And before you start talking, please introduce yourselves, get a little bit about your background. And I just want you to know this is a subcommittee on this whole notion of reimagining public safety in Akron. And this subcommittee is called Prevention. And essentially what we're trying to do is look at ways in which we are already doing things in Akron and working with the police department, but trying to look at those programs that would take the pressure off police and add some additional benefit through social services of those individuals with special talents and skills. And I know that the quick response team, you've had some counselors and social workers to go out with officers in addressing the alcohol and drug problem. So Jackie, I'm gonna turn it over to you to introduce yourself, give a little background about you, and Tony, do the same, and just talk about the quick response team. And as I talked with you yesterday, you said that you had some insights and some thoughts about ways that we can continue to improve this service. So I'll turn it over to you, Jackie.
Yeah, Jackie, I'm sorry to interrupt, but I just want to make sure, Mrs. Viviano, we need to approve the minutes of the meeting. Okay, so do I have, Mike isn't here, so I guess we're just going to be Linda and I, but
So move.
okay, so it's done. Okay.
Okay. Okay. So Jackie, can you hear me okay?
I certainly can. Thank you. And I appreciate you inviting us to talk about the quick response team and what we do as part of that initiative. I have a background in behavioral health, and I've been at the health department about, I think 4 years, 5 years. And prior to that, I have been working around the opiate stuff. I worked in Stark County. When all the opiate stuff has hit, we've watched it. We've done lots of different programming, trying to figure out, what it is that we need to do to, keep people alive and also connect with people. So we were approached by the ADM board to be a part of this project. It was born out of Cincinnati, where they had a small town down by Cincinnati, where they had a team that did outreach for people who had recently overdosed. And that was in response to knowing that it was started in this small community, that they had to change the paradigm of how they were interacting with people who had overdosed, and needed to really send a message to people that they had a community that was interested in them and cared about them, and wasn't just there to kind of arrest people. Years ago when the opiate stuff hit, we all agreed, there's no way we were going to arrest our way out of this. There was no one strategy that was going to be able to remediate what it was happening to our communities. So that's kind of how it was born. That was part of the underlying mission, was, again, to be able to communicate with our local communities that, here are some people that are caring about you, concerned about you, want to help you, want to connect with you, and help you get whatever you need, because we think you're valuable. Ours started here, I want to say it was about the time when I came here, about 4 years ago. We've had a couple different kinds of staff that have done it. We go out our team goes out once a week, they have, police officer, someone from Akron Fire, and then one of our staff members. And I'll let Tony kind of talk about some of the things that she's done. We have used counselors or social workers in the past. Kind of depends on what kind of staffing that we have, or peer support. We've kind of used different people. We provide information to people when they go out knocking on doors, and help to get them linked to services if that's what they want. If they don't, we are able to offer them Narcan through our staff, so they leave a Narcan kit if they would like that. We leave our information so that if they ever decide that they need something after we're gone, then they have a way to contact us. So I think, by and large, I think we're most successful with our recovery coaching. I am a counselor and I am a social worker, so but I still feel that it's a good, I value recovery coaching and people with lived experience, and I feel like they have a unique way of connecting with people that us as professionals can't always do that. So that's kind of just a little bit of the background. Like I said, they go out once a week. We did have a lull when COVID hit, like everybody else, and they didn't go out for a while. Started back up, I think, in August. And every Thursday, Tony goes out. So I'm going to turn it over to Tony so she can kind of talk about, what her experience has been like. I know it's been powerful for her, and I know she's worked hard at getting people, some help and letting them know how much they're cared about.
Okay, thank you, Jackie. My name is Tony Cole Jones, and I'm a recovery coach with Summit County Public Health. I've been with Summit County Public Health 2 years in January. So I go out once a week with QRT. And what my experience is it's powerful and it's emotional because I'm able to connect with people right there in their addiction. I'm able to resource them with another recovery coach if they want help. I'm able to really address the drugs with the family. I really don't ask the client, do you want me to leave a Narcan? I ask the loved one, the mother, the sister, whoever they're in the home with, because those are the ones that's there watching these overdoses and trying to save their loved one's life. So what I would do is every week I give out at least 2 to 3 Narcan, and that was my goal. I never want to leave QRT without giving a Narcan. I never want to leave QRT without being able to connect and educate the family on what's going on out here. I'm starting to see that in the African American neighborhoods, and so many people think that is just heroin IV users, and it's not, because fentanyl is put in every drug. That's all the street drugs now. I have met a lot of young men who are out in the club drinking, took a pill, and that pill was compressed with fentanyl, and they didn't know it, and they end up in the hospital getting Narcan. I had a young boy, I didn't know how young he was until we got there. It was like the 3rd time we went out, and come to find out he smoked a joint, and the joint had fentanyl. He was 17 years old, and it like really broke my heart because he looked so much like a baby and he didn't really know what he was getting into. He was experimenting. I'm gonna try to smoke weed and he have to have fentanyl in it. Had a young man who smoked fake marijuana and it had fentanyl in it. So it's not IV users that I see all the time when we go and see who had an overdose. It's pills, it's marijuana, and meth. And so fentanyl is put in everything. So to be able to educate these families and educate even the clients on what's going on, and they didn't, I didn't know that the pill had this in it, or I didn't know, I was just smoking a joint, I always smoke a joint. So I think that you all need a Narcan here, especially when I can recognize that it's not even the young kid that's smoking marijuana, but the parent as well, and how it's coming in the house. And I recognize these things because myself is 16 years. It's been 16 years since I did drugs and alcohol. And it's been 14 years I've been working in the addiction community, along with South Street Ministries as well. And along with Broken Chains, jail and prison ministry. So when I'm out there, I use my lived experience. I share about myself. I get them to feel comfortable, to be able to open up, to be able to talk to me and say, hey, maybe I am thinking about some treatments. There's someone we can talk to, or do you know where some AA meetings at? So I take a resource packet and I have everything in there from the 211 streetcar to how to get your prescriptions half price. I leave a note with my name and number and the addiction hotline. I leave my personal number in case you just need to call, because it might take just that one phone call. I try my best not to be too far away from someone reaching out for help and needing help, and being resourceful and giving information, sharing some things about myself and showing them, how the other side of addiction look like when you really want it, and if that's what you want. So I'm very fortunate to be able to work with Summit County Public Health. For Jackie to put the confidence she puts in to go out there, even to do Narcan trainings, and even to work our syringe exchange program. She put a lot of confidence in me, and I put a lot of, and it's just a joy. Addiction is serious. I'm glad people starting to take notice of it and know it's a disease, and that it's not something that somebody just want to do, but something they got caught up in, and to get off of certain drugs, it's real hard. It's real hard. So thank you for having me.
Thank you. I have one more thing to interject, which is think you guys recognize my last name? Because my daughter did an internship with you.
She did. She did.
Yes.
Sarah.
Sarah,
Yeah, Sarah, that's my
yeah.
daughter.
Yes, I
Yeah.
love her.
Okay.
Hi.
Okay. In fact, I'm trying to get her to join us here. See if we can do it. We can work it. Yeah. Once you started talking, I said, yeah, my daughter did an arcane training.
She
Yeah, very
did.
good. Yeah, she loves you guys. She
Yeah,
finally became a social worker.
oh,
She,
good for
Yes.
her.
yeah, she's in
Yes.
Pittsburgh working for an agency now.
Oh wow,
I'll see
that's
if I can get her to join in just to say, just to listen.
Yeah.
Yeah. Okay.
She
That's
did.
beautiful.
She did good. She worked a lot in our syringe exchange, and
Mhm.
yeah, was helping us pass out Narcan and some sterile
Yeah, she learned a
supplies.
lot. She learned. It
I
opened
bet
her
she
eyes.
did.
Yes.
Yeah, but I don't want to disrupt the meeting anymore. Go ahead,
Yeah.
Mrs. Moby. Yeah.
You're muted, Mrs. Amobian.
Muted. I want to go back to you, Tony. Thank you so much, Sarah. Tony, because I am so happy that the Summit County Health Department is doing the same thing that mental health agencies are doing as well. That is using people with lived experiences to help us do this work. Because there's nobody better to help us than folks that know the road and know the ropes and can talk about things. Because a lot of times, particularly when you talk about going out in the field with the police officers and meeting with people who have gone through an overdose or hospitalization or whatever, and trying to get them familiarized with the services that are available. Because I can tell you that in Summit County, we're very fortunate to have so many resources available. And to hear you talk about the package that you send, that you give to them and your name and all of that. Can you talk about when you actually approach the house, who is the lead usually? Is it you or the police officer?
We take turns because I work with a great group and we kind of have fun with it. So if I get out the van first, I'll walk up to the door because sometimes when they see the police and they look out the window, they don't want to open the door. They don't want to open the door. So I will go to the door and knock. And if they do open, I say, hey, how you doing? My name is Tony. I'm with Summit County Public Health. And then the officer would step up, and the firefighter paramedic would step up. Sometimes the officer will go first and say, hey, nobody's in trouble, just here to check on you. So we make the greeting just as warm and as inviting because a lot of people say, do you want to come in? And because of COVID, we say, no, we'll step out, we'll stay out here and talk. But they when the police are friendly like that, they open up and just tell everything. Like they don't hold nothing back. They don't lie about what happened, And so I might say, well, what happened? Could you tell us what happened? And they'll just tell us, and to be able to say that in front of an officer is like a beautiful thing to watch because there's no intimidation there. They know that they're not in trouble. They thank us because they see that somebody care. They can, and sometimes when it's like a first attempt, so we do a first attempt, a second attempt, a third attempt. So we don't get to the first time, we come the second time. We don't come the second time, we come the third time before we take you off the list. But we try real hard to make that connection. The officer even have phone numbers. He'll give them a call. If we can't get him at home, when we get into the truck, sometimes he make the connection over the phone. Tell us how you doing. Can we do anything for you? And we don't ask for who you got it from and who you this. We just want to know how you doing. You need any help? Well, what happened? You want to talk about it? It's been a couple of times where my heart just broke because I had a mother just tell me about the whole addiction story with her son and how hard she's been trying to get him some help. And she's so glad we showed up. She's so glad we left these resources. I mean, it's just the gratification you get from that, to see someone getting help or see a family mending together or a mother or a father really wanting to know what's going on with my child, how can I help, or even to tell them about some resources that's available to the mother or to the wife or to the husband for support so they can get an understanding of what's going on with their loved one. So the greeting when we knock on the door, either I will knock or the officer will knock or the fireman will knock. We'll just take turns knocking to see the reactions and let the greetings be warm. So, when they see us, and it's been a couple of times we've seen a person on the first attempt, we thought everything was okay. They said they were doing fine. And 2 weeks could go by, we don't see them, and then they back on their first attempt again. So when we go back, we say, oh, wow, what happened? You okay? And they just automatically just start, I made a mistake. I did it again. I'm sorry. What can I do? Now they want help. Now they want resources, but they're not scared. You know, there's no intimidation there.
So how many coaches do we have in Summit County like you? Recovery coaches.
It's a few. I don't know exactly, but I'm starting to see a lot of people getting their recovery support state license. So I just renewed mine, and I'm in school now for human social services and chemical dependency. I got 1 year left. So being a recovery coach has made me want to. Everything I do is in connection of helping the community. So being a recovery coach has took me to like different spaces and levels in my head I never thought I would be. And so I found myself more like, I think I need to be a chemical dependency counselor. Matter of fact, I know I need to be one. And just to be one and a recovery coach is like a win-win for me and for the person on the other side. So it's a lot of recovery coaches. ARC has a lot of recovery coaches. So I have everyone that works with me contracted from ARC. All of them is in their recovery, 2 to 3 years clean. They're recovery coaches and they are great. They are absolutely amazing.
Well, that's fantastic. Yeah, you very much need to be a counselor, a chemical dependency counselor, because this is the work. This is how it used to be before they got these licenses and all of that. I have my license in chemical dependency as well. Jackie, can you talk a little bit about? I know you're the manager. Are you the manager of this program?
I am.
So financially, how many recovery coaches do you have? Sounds like they go out once a week, so they go out 52 times a year or more.
So specifically for the quick response team, we have one. Tony is our only one. They go out just once a week. And, you know, some of that has to do with the staffing of, you know, our partners. We are actually paid through the ADM board,
Right.
but I think we're paid through them through a grant that went to the city, that came out of the Attorney General's office, I believe. And so, yeah, and so, you know, they pay us for actual time. You know, it's cost prohibitive to have a counselor, you know, or a social worker, licensed social worker. So we have done that. We did that for a long time. Didn't break even because of the rate that we get paid, but felt that it was important, so we did it anyway. You know,
Yeah, it's extremely important because we know that most of the crime that's committed, I bet 99% of it is kind of, you know, entangled with drugs in some manner, whether the person is using drugs, selling drugs, whatever the case may be. We could certainly use a lot of resources like this. What do you have any idea what your budget is? If you don't, you can get that back to us.
I do. I want to say it's, you know, I think it's around 26,000. Waving at Sarah down there. And again, it's based upon, you know, going out 1 day a week. There are, I think countywide, there are about 160 recovery coaches in different positions, but there aren't enough. And I think that one of the challenges that our behavioral health system has is that the pay scale is, I don't think it's high enough. I mean, and you know, I think that you know, we should be paying them at a higher rate because of the work that they're doing. I think is really important. So,
sure. You know, when we talked yesterday, you said you had some thoughts and ideas about how things could be either improved or some additional services, I guess we could add to this program. Have you thought about those? Would you like to share? Because there's no harm in sharing. You know, we all got a wish list, and if we could change the world, we would have more of this and more of that. But if you could think of something that you can identify that could be very helpful, because again, as I said, if we could prevent folks from getting into trouble as a result of drug abuse and drug use, we can certainly save a lot of police officers' time and prevent a lot of things from happening.
Yeah, I think, you know, we have some challenges in terms of how they choose to go out. And that's kind of based upon confidentiality, but it's also based on some safety issues. You know,
Okay.
people have open warrants. You know, we don't want to set them up, or if they're part of an active investigation. So sometimes that kind of limits the list of people that they go out to. I know that there are some teams that are going out to follow up, use this as a model for suicide prevention, because we also know a lot of people that attempt suicide are also under the influence. You know, I think you know, we could always, you know, build it out a little bit more, because you never know who it is that people are going to connect with. Certainly family, being able to do more with the families, because, you know, again, you know, they're the ones that are kind of living through this. So, you know, like with anything, we all struggle with funding sometimes. You know, we could have a dedicated person that kind of went out anywhere, you know, every day to do that street outreach. But we also know that it's, you know, cost prohibitive to do that. Everybody's got kind of tight budgets. I think it's important that we have, that you choose the right people, because you know, not everybody kind of buys into the idea of reaching out to people that are a tough population, because, you know, many people show up on the list over and over and over again. And I know the toll that that takes on our first responders. And so you have to be a little tenacious, and you have to be, I think, forever hopeful that this may be the time that something connects, and you don't always know who it is. And I think, you know, what kind of profession is going to do that? It might be fire, it might be police, it might be the recovery coaching, but you know, that's a pretty powerful message, I think, that is sent to the community when you got people that are taking time out of their day to come see how you are, because people in the midst of addiction aren't welcomed a lot of places. So I think it's a great program. I mean, I think it has application with other things as well. It works. I think they all work really well together as a team. And you know, occasionally they stop for car traffic accidents and everything else, you know, but yeah. So
I don't know, Mrs. Swirsky, do you have any questions? I don't want to take all the time.
I guess, and maybe you've kind of said some of this, but you know, the question is, when there's a call into our dispatch and we send a police officer, there has been people in the community and say, well, maybe the dispatch should instead call social service. And you're pointing out that there are 160 recovery coaches. Is that would be and there's only one at the Summit County Public Health Department. Is that?
I have, well, in my program, I have one. Tony is our full-time person, and then I have contracted with an agency, and so I have 1, 2, 3, 4 that do other 5 that do other work.
Okay. I mean, can you see a possible, you know, someone last time we met said, you know, it may not be safe to send at the first call to send a social work person. What do you think about the idea of our dispatch sort of referring or sort of working collaboratively with, from point on, that some of these calls get diverted directly to you guys? Could you see that? Or police, if you want to, Captain Beitzel, if you want to respond to that too, but let's let her first and then you. Is that okay?
Sure. You know, I think that there's lots of opportunity to figure out how to do services on demand, especially in a crisis. You know, they're, you know, we don't want anybody to get hurt. And we certainly don't at 2 in the morning want, you know, I'm not going to send Tony out at 2 in the morning, you know, without making sure that she's safe when she goes out there. So I think there's a safety piece, but I also think that, you know, you have to align with what the emergency is with the right people instead of a one size fits all. You know, can't expect police officers to be social workers or to be counselors. We can't expect our counselors to, you know, carry a gun and be in charge of everyone's safety as you guys are. So, you know, it's like trying to find that right blend. I'm a strong proponent of multidisciplinary teams. Situations can get out of control quickly, but they can also sometimes be diffused quickly, depending on who's there, what's said, and what that all kind of looks like. So
that's a very interesting notion, like you're saying, sort of a collaborative, a multidiscipline team. That sounds very like it would have a lot of potential. But there's also a perception that if the police are there, maybe someone doesn't want to talk. Now, you and I think Mrs. Jones said, no, they'll talk. If Mrs. Jones has such an engaging, you know, effusive personality, probably she could get anybody to talk to her, even no matter who's standing next to her. I could see that. I want to talk to her, you know. I got my daughter back just to see her. But yeah, but you know, what about that issue of if they are closely seen as working with the police? What's been your experience? Is that a problem from just getting people to open up and cooperate? Would you see that as a problem?
I can jump in, and then Tony, you can.
Yeah.
I think it's all about relationships. You know, relationship is what gets people into treatment. Relationship is what helps keep them in recovery. And I think if you have the right people with the right intent, you know, if people go in there with an intent of, I'm really concerned about you, I really want to help you, I'm not here, you know, I'm not going to try to arrest you and shame you and all of those other things.
Right.
I know lots of people that got into recovery because of their relationship with law enforcement. So,
okay.
Yeah.
So it's a lot. So sometimes the individual personality and persona overcomes whatever fears people have or sense that this is your role, you're police, you're here to punish me. And so I'm not even going to talk to the counselor. Is that what you're saying? So the people are well trained and well motivated. You think it could work? Yeah.
Like the first thing the officer says is when they open the door, he say, "Hey, how you doing? You're not in trouble. I'm just here to talk. Check on you."
Yeah.
My biggest thing, one of the main things I say at QRT and in the clinics is that it's not about the syringes, it's not about the drugs, it's about you. How you doing? Are you okay? What's going on with you? Do you need anything? Like I don't look, I have a blind spot. I'm not gonna look at you as an addict. I'm not gonna look at you as a stereotype overdose. You are a human being and you need help. And for you to start talking to us, evidently you calling out for help. And in some type of way, I got to maneuver my way in there to find out what can I do for you or make it comfortable enough for you to just pick up the phone and maybe you're going to give me a call one day, you know? So, yeah.
So you have a lot of potential. So I don't know, Captain.
Yeah, I know that Lieutenant Miller also has some
okay, good
thoughts that he'd like to share. But let me just say real quick that we do. First of all, I agree that there is definitely a role in law enforcement and I'm glad that the QRT program is so successful. And I would like to see it expanded on. I know that there's a role for it, but there is also many of these calls are criminal in nature. And I think that we need to remember that we're police officers, and then some of these crimes aren't just people overdosing. They're committing crimes against other citizens because of the way that they're behaving. whether it be, as a result of being on drugs or because they need the money to get drugs or whatever it is. So I said it last week, it was me that said it, Rich, I'm very concerned about the safety aspect of sending social workers on these calls. Alone is a definite no to me. Maybe after the fact, after a police officer has come to a scene, assessed the situation, made a determination on we call all the time to say, hey, we could use some help here. A lot of one example would be victims assistance we call for things, or other agencies we call because we aren't experts in everything. We don't have all the training in everything. We realize when we need some extra assistance. And I think that is our role, is to identify what we have on hand. We take care of, the safety of the scene first, and then maybe bring in somebody who could, handle whatever situation is at hand, whether it's, referring to counseling, or if it's a suicidal suspect, subject, something like that. But I think just to look at all of these and say that there are other potential victims that need to be taken care of in terms of, do you understand what I'm trying to say?
Yeah,
I'm
sure.
very
You're
worried
doing a
about the
great job.
safety.
You're doing a
And I
great
know,
job.
and I know
Yep.
Lieutenant Miller is just dying to jump in. So go ahead.
Well, good.
Lieutenant
Go
Miller.
ahead, jump in. Yeah.
That's your cue, Mike.
Captain Beitzel took essentially all the words out of my mouth, and I couldn't agree
And then
more.
she told you, let him speak.
No, but she was right on point, and that's a lot of what I was going to speak to. Obviously, this is a very essential platform. The reimagining public safety or police is a necessary conversation to have, and our expectation from the police department standpoint is that it moves us closer to a better product to be able to provide services for the community. I hope and I believe it is the position of the senior leadership on the police department that we are realistic as we move forward toward December and a final report, et cetera, and that we strike a balance between what is necessary and realistic versus what recommendations may come out of this. Because as Captain Beitzel said, most of the calls have a criminal component to it. And even if those that don't, there's a huge ongoing and probably a forever expectation from the community that from a taxpayer standpoint, they want to see and or talk to a police officer. So there's no one on this panel I know that would ever advocate putting anyone in harm's way. And like Captain Beitzel indicated, we have been conditioned, trained, prepared forever, equipped to make necessary referrals through our dispatch center, our services component of our dispatch center. So we, I think, will probably and should continue to be the front line, the face of that community response. If we deem that it is a family problem or a situation where they lack resources, then from a referral standpoint, that might be the safest way to go about doing that. And, not every, Miss Jackie made a good point earlier with respect to that other specialized training. One of the things that the chief was very intentional to do with respect to this subcommittee is ensure that we had folks on the subcommittee from the police departments in that wear multiple hats. Captain Beitzel being the lead of that, myself, I have a license, a degree in social work, I'm a licensed social worker, as is Sergeant Donahue. So we share the panel's sentiments in terms of specialized referrals and things of that nature, but I don't think it would ever be tremendously realistic to put some of those services as the front or even in step or parallel with our responses to some of these homes, because it can turn, even if it's not volatile or violent, the potential for it to turn is too great. So essentially we, like Captain Beitzel, wouldn't want to put anyone in harm's way.
Yeah, and what I think would be helpful at this point, if it's okay with Mr. Swirsky, we can bring Candace Palante in to talk, because Candace and Lieutenant Miller work closely together when he used to be the security officer over, and this was in his off hours, I guess, over at PASS. But it'll be an opportunity for her to talk about what she has done over the years. Candace, can you hear me okay? Candace?
Hi.
Hi. Why don't you just share a little bit about your background, and I know that what we've been talking about is an extension of what you do as well. So why don't you share that?
So I'm I'm a vice president of Portage Path Emergency Services. I'm a licensed social worker and a registered nurse. I've been with Portage Path since 1992. So I've been here quite a while, and historically I also worked in the Summit County Jail and ran the mental health unit there. So Portage Path Emergency Services, we're open 24/7. The ADM board, we're in the ADM crisis building. So I have here a psychiatrist, registered nurses, licensed counselors, social workers, Akron Police Department's our security. So we're here 24/7. I have 4 functions in emergency services. We have this, and you can ask me questions. I'm going to briefly go over some of them. We have the 24-hour crisis hotline, which we're here. Police officers are trained that they can refer mental health clients or anyone to our hotline. I have a crisis stabilization unit, which is a 16-bed crisis unit that we can put clients on to stabilize clients out. There's emergency services, which again, we're open 24/7. So CIT officers and police officers, probation, parole, all ERs, voluntary walk-ins can come into emergency services, and we will do an assessment and determine least restrictive alternatives from somebody being seen and then released back into community with follow-up, all the way to we hospitalize to local hospitals, inpatient psychiatric units, to the state mental hospital, which is North Coast. So we're the ones doing that assessment in the community. So after hours, and mostly after hours and weekends, it's an emergency room in Summit County or PEZ, who's evaluating people in the community for some sort of crisis, whatever that crisis may be. So we're here doing that assessment. And then I'm also a deputy clerk for Judge Stormer's probate court. So I do, and some of my staff do, evaluations for the court. So I agree with Lieutenant Miller and Captain Beitzel. I've been going out in the community under the probate court's jurisdiction since 1996. So I have the history of going into homes in crisis situations. And the officers, specifically Akron, most of our cases come out of Akron, but we go to all communities in Summit County. But if somebody in the community believes that somebody's mentally ill and they believe that they are a danger to self or others or not able to meet their basic needs, police officers under the Ohio Revised Code 5122 have the authority to make that assessment in a mental health crisis and remove them from their home and take them for a psychiatric evaluation and or to an ER or to psychiatric emergency services. So in that regard, if I'm taking an affidavit for Judge Stormer's probate court, whereas a police officer is in the home and they're called immediately to the home, I can take affidavits from family members or anybody else for the probate court. It's the same law, the same criteria, but I sit with the family members or whoever, and they have to sign the affidavit, which gives me permission to go out to the property, knock on their door, and do a mental health assessment. And I think with this group, as you're learning things, it's a good idea for your group to think about civil law versus criminal law. Because for somebody to walk on somebody's property and knock on a door in some kind of crisis situation, you have to have a reason to be on their property and knocking on their door in order for that crisis to be looked at. You can voluntarily go knock on a door, which is great, which the program that, public health is doing that's a wonderful program. It's a valuable asset. But when you're thinking about a crisis situation, you really have to think about who's walking up to that door and who has authority. Portage Path's on the advisory boards to the mental health court, to the CIT advisory board. We do the teaching. We're on the opiate task force. CSS has wonderful programs because they're treating the severe population of mental illness. We all communicate very well together, but connected to crisis, you have to have the criteria met for the law to go onto those properties. And I can tell you, I've did this since 1996 for the probate court. I've been employed with Portage Path because we're part of that contractual agreement. It gets pretty dangerous, pretty scary. I go out in the community by myself to do these assessments, but I gather their histories, their police records, their everything and anything I can possibly find on that person prior to going out. But if I feel after that whole big story I found uncomfortable going out, I have the permission of the probate court to call any police department in Summit County to go with me.
Mm-hmm.
And it comes down to, again, civil and criminal movement.
Mm-hmm. Do you mind if I ask just, could you specify how we handle a domestic violence situation? Is there?
You'd have to, I think Captain Beitzel or Lieutenant Miller would have to answer that.
Rich, are you asking me what we do when we respond if we get called to a domestic situation?
Yeah, does a social worker get called to be there with you?
No.
We wait until another time.
Those are sometimes the most dangerous situations to respond to.
Linda's exactly right. Domestic situations, I would never bring a civilian into. A lot of times when we have ride-alongs, we don't even let them come into the house on a domestic situation because, historically, they are some of the most dangerous calls you can respond to because of the heightened emotion and everything that goes along with it. I'm sure I don't have to explain that to this panel. So,
no.
But afterwards, we do make referrals to, if it ends up just being a situation where it's an argument that's escalated, hasn't turned violent, a lot of times we do refer out if there's a situation where victims assistance needs to be called because there's been a serious situation in which somebody has been harmed physically, then we'll do that. But there's always a police officer there with victims assistance.
Right, but that's a follow-up. But I mean, the initial scene,
no,
there's
never.
no one there sort of trying to, I'm not sure. The police who do we have police with special training show up in domestic violence situations or?
Rich, domestic violence situations are like our most popular call. We train extensively from the moment we are in the academy all the way up through. And because it's our most popular call, we get a ton of experience in it. And
yes.
So
okay.
that's something we're very, very well trained in on handling our domestic situations. So no, we don't have any social workers. Lieutenant Miller, do you want to add to that?
Yeah, so just very briefly, she said it again, right on point. That would not be the occasion to bring any civilian or social worker in on the front line of that. But like she indicated, that would be the perfect time. There's behaviors linked to feelings linked to behavior. So a lot of times these fights, we try to get to the bottom of what the motive of the argument is. If it's a resource issue, lack of, whether it be a financial crisis, utilities, food, and then we go to referral mode, and that's where that call is able to be maximized, but not to invite someone on the front.
Okay, so there is the follow-up does happen, is what you're saying, with social service people, but it's not at the moment when things are heated.
If appropriate.
And maybe volatile.
If appropriate, obviously we're problem solvers. As Lieutenant Miller said, if the situation that they're fighting over is something we can refer to another agency to help them put a permanent fix on, then absolutely. We talk to people, we problem solve, we find out what their situation is, what they're fighting about, and we try to apply resources. Sometimes there isn't anything. It's just they just simply don't get along for whatever reason. But yes, Rich, we always, that's where it's very helpful to know the resources available in the community.
Mm-hmm. That's part of the, yeah. Oh, go ahead. Someone else wanted to say something.
This is Candy. I also want to interject that for mental health, every Friday, the mental health system meets and we talk about every mental health client that we know, or maybe there's someone who isn't in the system, might be homeless outreach, or might be someone at the Haven, or somebody that we know might have mental health issues. We talk about them every Friday. We have monthly meetings with the ERs. We talk about every case that we know that could be an issue. The ADM board and Akron Police Department is very involved with communicating with us if there's these type of cases. We do a fairly good community collaboration with each other. So if there are those cases,
Sounds like that.
public health could refer people, that we would go out and look at these cases.
Right. And it sounds like what you're saying is a lot of the cases have some history.
Yes.
And you're familiar with the history and the needs of these clients. But doesn't it happen that sometimes some new people who you didn't know about, one of the agencies hasn't already seen, or is there?
Certainly, and that's where people can contact the probate court through Portage Path if they believe somebody is in a crisis and they believe that it's a mental health issue, and substance is kind of in that category, that someone can sign an affidavit and have an investigation done. That's just an investigation to see if we need to intercede in some way. Where police officers are trained through CIT, that if they go out and it's kind of an iffy case, they can tell the family or whoever also to call and talk. It's a free, well, it's a public service. We don't charge anything to have these conversations. So Akron Police, or all police departments in Summit County, are encouraged to have people call if they believe that the person's in crisis and that they have mental health issues and possibly could be a danger to self or others, and are not meeting their basic needs.
Okay. Anybody else want to ask Ms. Obumby, anything else to ask or bring up? Or?
Well, I'm wondering if I think that I just want to point out here in the Akron area, I'm wondering if everybody realizes, or I should say council realizes, how absolutely lucky and fortunate we are in Akron to have CSS, to be able to have psychiatric emergency services, I'm sorry, to be able, for us to be able to utilize, we utilize all the time. Most departments don't have that kind of a resource right there. I mean, within 2 or 3 minutes from wherever it is that they are, to be able to take somebody to. Same with our outreach program and all of these things that we've talked about that we all work collaboratively together with. That's what makes, and it's not Akron Police Department that's great. That's what makes all of us great together, and the services that we're able to provide for the city. And, you know, I would actually ask you to go ask a lot of other jurisdictions if they are so fortunate to have the kind of services we have here in Summit County as a whole, with homeless outreach and with psychiatric outreach, drug and alcohol outreach, all of it here in Akron. And so Akron Police Department is well schooled on our resources, and we teach it, we talk about it all the time. And so I hope if anything, you guys everybody here is learning how well we all work together, and just how lucky, I guess, that we are. And thank you, Candy, for your words today. Appreciate it.
Yeah, and I think that's what we wanted to emphasize, is that we are very fortunate in Summit County to have a rich range of resources, and how the social service community and the police force are always collaborating in situations. And we have a number of committees where there are officers on the boards or the committees giving their input on situations. Because we also have, in addition to the programs that Candace has talked about and Jackie and Tony, you have a committee called Tough Stuff. That's when you have representatives from different agencies dealing with some of the most difficult cases of individuals who find themselves in, and we're just trying to figure out who can step in and help this individual out. And they're very challenging cases. So I know that we already are doing a lot of things together. I guess what I'm thinking about is we probably need money put in some more of these programs to do more of this work, not less. Because if the quick response team is going out once a week, and kind of wonder, why can't we have them go out more often? Why can't we hire more recovery coaches to do more of this work? So there are opportunities. And I think every time we do something like this, we can prevent more serious things from happening. Because as I indicated before, a lot of the crimes and things that are committed are due to drug and alcohol abuse. And we have mental health individuals who are duly diagnosed, who have mental health issues as well as substance abuse problems. And that combination can be, very, very dangerous and very difficult to treat. So there's just lots of opportunities for us to do more together.
Yes.
And I don't think anybody's suggesting that we do it alone, but just find ways to continue to work together and put our resources where we think they should be.
Very well said. And with
and
that,
I thank all of you, Jackie, Tony, Candace Palante, please, thank you so very much for being with us today. If you have any other comments or questions, I'm sure Mr. Swartzky would want you to,
yeah, if anybody else wants to make a final comment, because we're about to adjourn, we promise you we adjourn about 6 o'clock. If you want to make another, I appreciate, I think Mrs. Amobian's final comments here are really telling, and I think, but we're learning, and it is impressive the amount of collaboration and cooperation between the different agencies and the police. And thank you, Captain Beitzel, for making sure we see that. And also Mr. Miller. So with that, I don't know if Mr. Richardson, Trevin, you want to just make an announcement about that article so if people want to read it ahead of time for the next meeting? Just a quick announcement. What's the name? Or we'll send it out to emails. How's that?
Yeah, that sounds good.
Okay, and we'll try and get that. And then there's a young woman.
Swirsky.
A young woman. Yes, Miss Swirsky.
I wonder if too, I'm sorry to, coming in from the outside a little bit, but, if meeting with also some of the victim assistance providers too, especially with VOCA funding being cut, that 40% funding being cut, I know how closely that, the police sometimes work with domestic violence agencies, especially with being the first responders there. And I think, because I work in domestic violence right now, and it's so important to keep that relationship, especially those referrals happening. And if there's some sort of funding, I'm sure that, bringing them in, maybe if there's some sort of way of funding, I know that they're very concerned with funding cuts right now, especially in Ohio with that big cut.
Yeah. Does anyone want to respond to that a little bit? Are we already doing that, or we need to make
I know
sure
that they're
do?
probably meeting about it. I'm in Pennsylvania right now, but our funding's okay, but I know it's probably a huge concern, or it is a huge concern right now.
Cuts to victim assistance.
We
should invite them to a meeting and have them brief us on kind of their situation. That's good. That's excellent suggestion. And with that, then see you all again, and thank you. Those of you who've been grinding it out either in law enforcement or in social work. We appreciate what you do. Neither job is very easy, but they are so important, and we value you and we're grateful. Thank you.
Thank you for inviting us.
Yeah.
Thank you. Thank you so much.
Great discussion. Great speakers. Great.
Yeah.
So much knowledge and experience. Thank you.
Yeah.
Welcome.
Hey, Sarah.
Bye-bye.
Sarah.
Bye-bye. Thank you.
She was always more popular than me. So.
Sarah.